Talus, and you can see with each of these muscles I've got attachments written. Now, I put them on the slides for you, the attachments, but I know you people, this is what you're going to do. You're going to look in your book, right, at the attachments, and you're going to compare those to the ones that I've written. And when you do that, you're going to find that mine aren't exactly like the ones in your book. In fact, I have, a half dozen different authors of different anatomy books in my office. And if you look at them, none of them are exactly the same. So what I've done, so they're all very similar, right? But they're not like attaching things to different places. But the wording of the descriptions are slightly different. Well, you want to say the floor of the intertubercular groove, or you want to say the edge of the bicipital groove. I mean, they're the same places, but different ways of describing exactly where these things are. So what I did with this is I tried to describe it in terms that, for me, are the easiest to remember without the horrors of the details. There may come a day in your life where you have to learn all of the horrors of the details. But I would like for you to remember something. So I've tried to describe it in a way that you will be able to remember. The point is to say, the muscle is here, and I'm trying to remember where it attaches. So I'm not even going to distinguish between origins and insertions for you. Every textbook has a table with the muscles listed, and in the first column it has the origin of the muscle. In the second column it has the insertion of the muscle. And by definition, when the muscle contracts, the insertion moves toward the origin. So you memorize these tables of information, right? And then in the last column it will have two more columns. It will have the innervation of that muscle, and the last column it will have the action of that muscle. So, what am I supposed to do with all of that? Well, I will describe these muscles to you in terms of their attachments. In fact, some books will call muscle attachments proximal and distal attachments. In a lot of places, you get proximal and distal instead of origin insertion. I'm not even going to do that to you. I want you to know where they're attached. So in your next lab test, that's the way it's going to come out. What muscle's attached here, and where else does it attach? So you touch the muscle and you think it goes from here to there. And can I describe those things? So that's what these are in terms of descriptions of where these muscles are attached. And I don't even have all of them labeled here, but I want you to be able to touch the outside of your head, and whatever you touch, I want you to be able to tell me what muscle that is and where it's attached. And then how it's controlled, what nerve controls it. The good news is it's the same nerve for all of them. The facial nerve controls the muscles of expression, and so that is our job now, to talk about the muscles of expression. All right, so the first one is the frontalis, and the frontalis muscle has attachments to the gallia aponeurotica and the skin of the eyebrow. I have cranial nerve 7 written here. I didn't write it on the rest of them because they all get 7. These muscles that I have on this picture all get cranial nerve 7, the facial nerve. On old Olympus towering top, a fat, vicious goat vandalized a hat. Olfactory, optic, jump in anywhere, students. We do it many, many times. Oculomotor, trochlear, trigeminal, abducens, facial. Okay, so we're at the 7th cranial nerve now, innervating the muscles of expression. The first one is the frontalis. It attaches to the gallia aponeurotica, skin of the eyebrow. All right, what do you mean, gallia aponeurotica? Well, the frontalis, as I illustrated for you with my own head in here, when talking about dense regular connective tissue, I illustrated for you this phenomenon, the epicranius, the two muscles that are connected across the top of your head. The occipitalis on the occipital bone and the frontalis on the frontal bone, neither one are fused to the parietal bone. Instead, they are fused into a tendon sheet on the top of your head called the gallia aponeurotica. An aponeurosis a dense, regular connective tissue sheet of tendon on the top of your head. So this muscle reaches back across to attach to the occipitalis, and you can see it, right? You remember my stupidity from before, right? This is what it looks like. The frontalis is attached to the occipitalis. All right, the next one is the muscle around the eye, the orbicularis oculi. There are two of these circular muscles. One of them circles the eyes, and the other one circles the mouth. The eye is known as the orbit, right? And what would you call the cavity of your mouth? The oral cavity, right? The orbital cavity and the oral cavity. So this one is called the orbicularis oculi, and this one is called the orbicularis oris. So this is the primary muscle to close your eyes. We're going to learn a lot of these little doodahs here with the movements of the eyes, but the orbicularis oculi is the main muscle to close your eyes. And it has attachments to all the bones that it circles here. You can see it attaches to the frontal bone. Yeah? So it has attachments here on the frontal bone. That makes sense. But look, as it comes down this way, it also attaches to the upper jawbone. So it has maxillary attachment. It has frontal and maxillary attachments. And of course, it's attached to the eyelid here. So it actually helps to close your eyes, the orbicularis oculi. All right, let's talk about the happy muscles. So first on the list is the levator labii superioris. All right, in anatomy, to say superior means on top. To say levator means to elevate, right? So we're going to put one of these on the scapula too. The levator scapula is going to elevate the scapula. The levator here is attached to what is called labii, an anatomy word that means lips. When you see the word labii, you think lips. This muscle is called the levator labii superioris. So it must elevate the lips from the superior side. You see that? Its name tells you what it does. And its attachment is to the upper maxilla. It has an attachment over to the nasal bone and to the orbicularis oris. So the levator labii superioris is a muscle that actually helps to lift the lips. Now, can any of you, my mom had a friend that could do this, and when I see her, I always ask her to do it for me. Can any of you contract your levator labii superioris without contracting, without smiling? Can any of you do it? Y'all don't know what I'm talking about? I can't do it either, but it looks something like that, right? So my mom's friend, her name is Ann Ritchie, she can make her lip right here go up toward her nose. That's kind of the, if you talk about expression, I'm not sure what expression that is. That's disgust or skepticism, I don't know. But it is an expression, right? It's part of the expression of your face, the levator labii superioris. And some people I know have some isolated control. I suspect in a dissection you would see some kind of weird kind of facial nerve change in the way this muscle is innervated. And we all can use the muscle, but it is fascinating. And it's named for what it does. All right, more happy muscles. I'm not sure that's happy, but these are definitely happy. The zygomaticus minor and major you can see in order. So from the levator labii superioris here, we work our way medial to lateral. The next muscle is the zygomaticus minor, and then the zygomaticus major. So the minor and the major, you can see here, both have these shared attachments up on the zygomatic bone, up near where the orbicularis oris is. So from the zygomatic bone here, down to the corner of the lip are the attachments of the minor and the major. These are the primary muscles of smiling, the zygomaticus minor and major. The risorius attaches, next we're just moving our way down medial to lateral. So from the levator labii superioris to the minor to the major, the next muscle, this is normally a very small, thin muscle, not a very powerful muscle. The zygomaticus fibers are normally more substantial than these. The risorius muscle attaches to the masseter and the skin of the mouth. Now you don't know what the masseter is yet, do you? Does anybody in here know what the masseter is? In fact, you've seen it on your cat already. Yes?
Is it here?
Okay, good. So when you did, right, so when you pull the skin off your cat, the big hunk of flesh on the cheek is the masseter. Now, it's not labeled on this picture for two reasons. One, it's an anterior view, and the other reason, it's not a muscle of expression. The masseter is a muscle of mastication, so it's coming, right? So once you peel you peel this rhizorius away here, the bulk of the flesh here, right here, is actually masseter. There's a gland right there from your cat. What is that gland sitting on top of the masseter? You found a little duct, some of you, I showed it to you, that runs across the masseter and enters at the second molar. That is the parotid gland, yeah? And I told you before, you can't be mucking around with the parotid gland because the facial nerve passes through it, and today you're going to see that. I'm going to show it to you. That muscle, as we'll see in a moment, that masseter muscle is most of the flesh of your cheek. And that muscle is attached to the zygomatic bone here, and it extends downward to attach to the ramus of the mandible, all along the base of the ramus of the mandible. So when I see people in the health plex over there, now Peyton and Kaylee are pretty faithful, yeah? And they come over there and they're not wasting time. They're not in there jibber-jabbing, right? So if I run across some friends, they're sitting around the tables jibber-jabbing and not exercising, sometimes I'll walk over, especially if they've had anatomy, and I'll say, look, there's not enough mass in the masseter to get the aerobic work that you need. What did I just say? There's not enough mass in the masseter to get the aerobic work that you need. What did I just tell them? Stop your jibber-jabbing, right? And get busy. That's what that means. Okay, so this one attaches to the masseter in the skin of the mouth, the rhizorius, you can see here. Then the orbicularis oris. This is the kissing muscle. So closing your mouth and puckering. It attaches to the fascia around the lips and the mucosa around the lips, the orbicularis oris. Now let's do across the bottom of the lips. So 3 of these. So you learn medial to lateral. This is how the test question will be written. Hint, hint. Medial to lateral, yeah? Name the muscles. I touch them. Can you name them? Levator, labii superioris. What's the next one? Zygomaticus minor. What's the next one? Zygomaticus major. What's the next one? Rhizorius. Are you following the sequence here? Okay, so let's do it on the bottom here. Since we did medial to lateral, let's do that on the bottom as well. So the most medial muscle here attached up here to the orbicularis oris is this one, the mentalis. It attaches to the mandible, near the mandibular symphysis, you can see here, and to the skin of the chin. So this makes it look like it's attached to the muscle, and there are actually fibers that extend into the orbicularis oris. But again, depends on which textbook you're learning. This is the easiest way I could think to describe it. It's on the mandible and the skin of the chin. The mentalis, right? The thinking muscle. What is the easiest way for you to illustrate, if you were doing Pictionary, and it says somebody is thinking about something, how would you illustrate that? Yeah? Okay, so I'm being very mental. Yes? The mentalis is the medial one. All right, and as we work our way lateral now, the next one is the depressor labii inferioris. This is the one on the other side. We had a levator labii superioris, and directly across from it on your lips is the depressor labii inferioris. So from the mentalis over to the depressor. This one's on the body, this is on the body of the mandible and the lower lip here. Very simplistic description. And then the final one here, as I work my way lateral before we get to the rhizorius, is the depressor anguli oris. Now, how are you going to remember that the labii inferioris is actually medial to the anguli oris? You know how I remember that? If I want to make a more substantial change in the angle, I need to be further toward the corners. And so the angular muscle down here, the saddest muscle on your face, is the depressor anguli oris. It makes the corners of the lips depress. All right, now I have this muscle on here, the buccinator, but I want you to put a star by it, and then I'll do the corrugator and I'll be done. The buccinator muscle is actually considered to be a muscle of expression. That's why it's on this picture. But it is an exception to my rule, because with the buccinator, I'm actually going to get trigeminal innervation. So it's going to show up on the mastication picture, and I'll make a point of this, all right, as we go. But I want to point this out. It's on this side. It's on all by itself here, and I'm going to make an issue out of it for you. It's attached to the maxilla, the mandible, and the orbicularis oris. Incidentally, before we leave the picture, what is that muscle right there? It's not labeled here, but there's a gland right there. Can you see how that is glandular? And there's a duct that crosses over here and goes into the mouth right there. You're going to see it more than once. That's the parotid gland, and that is actually the masseter right there. So the buccinator, as you can see in this picture, is deep to the masseter. All right, then the corrugator is the concern muscle. It's attached to the arch above the nasal bone and the skin of the eye, the corrugator. Sometimes it's called the corrugator superculi. You know, it's concern, the corrugator. All right, now let's talk about cranial nerve 7 before we leave it. This is our opportunity. It's the one that innervates these muscles, right? I should be able to say something more about it. All right, so the fibers of the cranial nerve 7 leave the pons and they travel through the internal acoustic meatus. Let's don't just read these things, people. Let's think as though we're on board the bus, right? Okay, have you seen the word pons before in this class? Okay? In what context?
Nervous system, giving the sensory information to the cerebral cortex.
Great, really well done. So the pons is in that pathway that I taught you from the Pacinian corpuscle, up the spinal cord to the brainstem. And the brainstem included the medulla first, then the pons, then the midbrain, then to the thalamus. Remember that? Okay, so we're at the brainstem here. This is where these fibers leave from the pons. And they travel from the pons of the brainstem. I want to get now, the brainstem is inside, right? I got to get out somehow. So I have to find me a hole. The nerve's got to find himself a hole to get out of the skull. And the one that it passes through, the hole it passes through, is the internal acoustic meatus. Now, what bone am I in?
Is it temporal?
In the temporal bone, right. So I'm in the internal acoustic meatus, a hole on the inside of the temporal bone. So the next time you look at the skull and you're looking there at the internal acoustic meatus, I want you to think that's how the facial nerve gets out. Now, it's not out yet. It passes through the internal acoustic meatus, and you think, well, maybe it comes out of the ear, but you know better than that, right? It doesn't come out your ear. From that internal acoustic meatus, it passes through the temporal bone and actually emerges out of the temporal bone through the stylomastoid foramen. Now, where is that hole? What bone is the stylomastoid foramen in? It sits between the mastoid process and that styloid process that sticks off of that bone. And what bone am I talking about? The mastoid process is a bony piece of the...
Mastoid?
The mastoid process is part of what bone? It's also temporal, right? So I want you to think about that. We're inside the temporal bone now, and we're making our way out of the stylomastoid to the lateral aspect of the face. I'm going to show you what that looks like. It's a mixed nerve. It has 5 major branches, and you're about to learn them. The motor functions include facial expression. That's the point today. Learn the muscles of expression on the face, on the bones, and now talk about the innervations. And look, it also transmits autonomic impulses to the lacrimal and salivary glands. Wait a minute. Autonomic information? Is it possible for a nerve to carry both somatic and autonomic information? Have you heard this before? Yes, you have. Okay. If I'm going to carry autonomic information to a gland, it either has to be of the sympathetic variety or the parasympathetic variety. And what are the 4 major nerves of the parasympathetic variety? 3, 7, 9, and 10. This is 7. Okay, so no surprise here for the anatomy student who's had a proper introduction. You have heard this. Now, where is the lacrimal gland? You learned this today. It's in the superior lateral wall of the orbit. Does it have a name? Does it have a bone named for it?
Yes.
Where is the bone named for this gland?
The medial.
On the medial wall. And why do they name the bone after the gland?
Because that's where it drains.
Because the tears have got to go through there to get into your nose. Right. This is normal pathway. And then the salivary glands we haven't talked. There's 3 sets of them, and 2 of the 3 sets are innervated by a facial, but we'll do that as we get to it. All right, and the last piece here, I'm going to show you a picture of this. The facial nerves, it turns out, by way of a slightly different pathway, just bring them up, bring them up, bring them up. The sensory function is taste from the anterior 2/3 of the tongue. So this is your first introduction to tongue, but I'm going to attach all the muscles to it and move it and everything for you as we get to it. But these are the major features of the facial nerve I wanted to point out to you today. Now let's track it. Here it comes. The thing is passing through the internal acoustic meatus, right? And it's going to exit by way of the stylomastoid foramen, and it's going to give off 5 major branches. And these motor branches, for today, the motor branches, this shows you some of the parasympathetic stuff to the glands. There's its innervation of the lacrimal gland right there, the parasympathetic fibers to the postganglionics. You do not know where this ganglia is. I'm going to show it to you later, the pterygopalatine ganglia. So you're going to learn, right? I told you have to learn where the ganglia are in the skull and how do you get things. So these things will come up later. We're not going to leave the facial nerve alone. But today the point is the motor branches of the facial nerve, and here they are. The top one is called the temporal branch. The next one, the zygomatic branch. The next one is the buccal branch. The next one is the mandibular branch. And the next one is the cervical branch. You will need to memorize the 5 major branches of the facial nerve that facilitate facial expression. I will not, because you can see there are multiple branch points for all of these. So I'm not going to go through this and delineate pieces and parts of muscles with different pieces of the branches of the facial nerve. You can do that later in your life. But you should be able to say something like this. Well, let's just say it this way. You should, by knowing the muscles and their attachments and where they are, I should be able to ask you large separation questions. Muscles on the top versus muscles on the bottom, innervated by branches of the facial nerve. So I want you to know these 5 major branches from superior to inferior: temporal, zygomatic, buccal, mandibular, cervical. Now, most of them make sense in terms of their names. If I had beat you up with it, you probably could have come up with these names as we talk about where these things go. Temporal, zygomatic. Buccal we haven't talked much about, but I showed you the buccinator, so that one's going to come up again. Mandibular and cervical, the 5 major branches of the facial nerve. All right, now before we leave it, I'd like to show students where these holes are, because I asked you a moment ago. So there's the stylomastoid foramen right there, between the styloid process and the mastoid process. This is, why does your teacher put this on this slide? Because I just mentioned this to you, right? This is how the nerve exits as it innervates the muscles of expression through the stylomastoid foramen. So you probably could guess what the next picture is, right? Why does this have the internal acoustic meatus? So I want my students to emphasize the pathway of the facial nerve. You got to get off the pons. How do you get out to the face? Internal acoustic meatus in the temporal bone and out the stylomastoid foramen. This is the pathway for the facial nerve. All right, now I also want to review with you, because we're talking about facial, the autonomic stuff. And we've done this already. But circle this, right? Learn it again. What are the major nerves carrying parasympathetic autonomic information? 3, 7, 9, and 10. So which one have we talked about today? Cranial nerve 7. Now, as we proceed in this skull phenomenon, we'll come back to this picture again because I want you to know where each of these ganglia are in the skull. So all you've learned so far is 3, 7, 9, and 10, and now you know 7 is carrying not only facial expression information to the muscles of the head, but it's also carrying parasympathetic autonomic. So we've got a couple more pieces we need to add to this before we're done. And the big one is the location of the pterygopalatine ganglia and a reintroduction again to the lacrimal gland and to the salivary glands. As I said, 2 of the 3 are innervated by 7. And it gets 2 ganglia. But we're going to do the details of that, so I just show it to you again. Keep showing it to them over and over again. Here's the piece at the bottom of that picture on what the facial nerve does for taste. The facial nerve, as you can see, is a major sensory piece. Now, what would you consider taste? Somatic sensory or autonomic sensory?
Autonomic.
Yeah, I think so. I think it's better to describe autonomic sensory, right? So this autonomic pathway, sensory pathway. And where are the taste buds on your tongue that use facial nerve 7? Well, let's learn them. Yeah? So the anterior 2/3, most of the taste buds. Now, taste is really, what we say taste is actually smell, right? Because there are only 4 or 5 really, different kinds of taste buds. And how many different types of taste does a human have? Is there just 5 different things that you can taste? Of course not. That's ridiculous. There are hundreds of things that you can taste. But when you say taste, what you really mean is smell. Yeah? So the anterior 2/3 of your tongue carries taste bud information into your brain. The posterior 2/3 is picked up by cranial nerves 9 and 10. Does that sound familiar? 7 and 9 and 10. So let me ask the question again. You think this is somatic information or autonomic information? And you said autonomic. You got some more evidence for that now? If I think parasympathetic autonomic, I think 3, 7, 9, and 10. And 3 of those, 7, 9, and 10, are autonomic sensory pieces coming off your tongue. So it's a good review thing here. 7 to the back, 9 glossopharyngeal, to the very posterior regions, 10. 7, 9, and 10, autonomic sensory information for taste. All right, so I'll review muscles of expression very briefly when we start next time, and then the muscles of mastication and the trigeminal nerve on Friday. The muscles of mastication and the trigeminal.